What is Medicare for individuals and families? Presented by Granite State Independent Living's Financial Planning and Benefit Services. What is Medicare? Medicare is a federal health insurance program. It has three parts. Part A is hospital insurance, which provides coverage for stays in the hospital, a skilled nursing facility, home health care, and hospice services. Part B is outpatient insurance, which provides coverage for doctors, outpatient hospital care, and other medical services. And Part D is prescription drug coverage. Who is eligible for Medicare? Individuals who are over the age of 65 are automatically eligible for Medicare. Individuals who have been receiving SSDI cash benefits for 24 months are eligible for Medicare. Individuals with end-stage renal disease and ALS, also known as Lou Gehrig's disease, do not need to wait 24 months to be eligible. SSI recipients are not eligible for Medicare unless they also receive SSDI. Does Medicare Part A cost anything? There are no premiums for individuals who are receiving or eligible for a Social Security benefit. Some individuals are eligible to buy Medicare Part A, and there is a premium for them. There are deductibles and coinsurance amounts for some of the benefits. For example, if someone has a hospital stay of 60 days or less, the deductible is $1,216 in 2014, and this deductible applies to each hospital stay. What are the costs associated with Medicare Part B? Medicare Part B has a premium and is updated each year by the federal government. In 2014, the premium for Medicare Part B is $104.90 per month. Some people pay a higher premium if their income is higher or if they are paying penalties. If an individual receives SSDI or regular Social Security, this premium comes out of their check. If not, they are billed quarterly. Medicare Part B also has a 20% copay on covered services and an annual deductible. In 2014, this deductible is $147. For certain low-income individuals, these costs can be covered in part by the state through the Medicare savings programs. What are the higher premium brackets for Medicare Part B? As you can see here, if your adjusted gross income is $85,000 or less for an individual, $170,000 or less if you filed jointly, or $85,000 or less if you filed separately, your premium amount is $104.90. And then the premium amount goes up from there depending on your income level. What are the Medicare savings programs? They're most commonly referred to as QIMBY or SLMB. The Medicare savings programs assist low-income disabled individuals who are eligible for Medicare by paying for some or all of the associated costs of Medicare Part B. There are two programs: Qualified Medicare Beneficiaries, also known as QIMBY, and Specified Low-Income Beneficiaries, known as SLMB. In New Hampshire, there are two SLMB programs, 120 and 135. Who is eligible for QIMBY-SLMB? To be eligible for assistance under QIMBY-SLMB, an individual must be entitled to and enrolled in Medicare Part A insurance as verified by the Social Security Administration. QIMBY-SLMB assistance is determined without regard to eligibility for any other public assistance program, including Medicaid. There are income and resource limits for QIMBY-SLMB. The resource limit for an individual is $7,160, and for a couple it's $10,750, and these are the limits for 2014. And these are the program income limits. This is for a household of one. For each additional household member, add $335 to the income level amount for QIMBY, $402 to the income level amount for SLMB 120, and $453 to the income level amount for SLMB 135. Are there any income deductions for QIMBY-SLMB? SSI does not count for QIMBY-SLMB. If you have unearned income, such as SSDI, you will receive a $20 deduction. If you also have earned income, then you will receive a $65 deduction, and then only half of your earnings after that will be counted. What are the costs associated with Medicare Part D? Medicare Part D generally has the following costs: prescription plan monthly premium, co-pays for prescription drugs, and some of the programs also have deductibles. The costs of Medicare Part D vary based on the prescription drug program you select, the medications you need covered, and if you receive extra help or have Medicaid. What is extra help? Extra help is a program for low-income individuals to help them pay for their Medicare Part D related costs. To qualify for extra help, someone must have resources below $13,440 for an individual and $26,860 for a couple. Annual income is limited to $17,235 for an individual and $23,265 for a couple. Some people with higher incomes are eligible for limited help. An individual must apply for extra help. You will not be automatically enrolled unless you are a Medicaid recipient. How do I enroll in Medicare? If you are enrolled, you will automatically be enrolled in Medicare Part A. You will receive notification of eligibility for Medicare Part B. If you do not opt out by replying to this notification, you will be automatically enrolled. You must actively enroll in Medicare Part D. You can enroll during the 3 months prior to eligibility for Part A or Part B, or for the 3 months after. You can also generally enroll during the annual enrollment period, which runs from October through December, and the coverage during that period begins January 1st. You are allowed to change prescription drug plans during the annual enrollment period each year. What if I don't want to enroll in Medicare Part B or Part D? You can choose not to enroll in Medicare Parts B or D. When you are notified of eligibility for Part B, you can opt out by responding to the notification. You can choose not to pick a prescription drug plan for Part D. However, for both Part B and Part D, there are penalties for late enrollment. For both programs, the penalty is 1% of the base premium, which changes yearly, for each month of delayed enrollment. If you had creditable coverage for services covered by Part B or Part D during the time you were not enrolled, you may not have to pay a penalty. What happens if I have Medicare and I have to go to work? Eligibility for Medicare Parts A, B, and D is not based on income and resources, so going to work should not impact your Medicare eligibility. You may lose your eligibility for extra help if your income or resources increase to above the limit for the program. Certain individuals with higher incomes may have increased Medicare Part B premiums. If you earn enough that you are no longer eligible for SSDI, there is a work incentive known as the extended period of Medicare coverage. This allows individuals to have extended Medicare coverage for up to 5 years after being terminated from SSDI due to earnings from work. I have both Medicare and Medicaid. How does that work? Many people have both Medicare and Medicaid. Medicare and Medicaid work together to cover healthcare costs. You may find that more of your necessary services are covered with both Medicare and Medicaid. Medicare Part D recipients have reduced or no-cost Part D premiums through Medicaid. They may also have reduced or no-cost copays and deductibles. What is a Medigap plan? Medigap plans are also known as supplemental coverage, and they're private health insurance plans that are intended to provide supplemental coverage to Medicare. They help pay for the gaps in Medicare coverage, such as deductibles, copays, and coinsurance. Medigap plans are sold by private health insurance companies licensed by the state. They are required to follow federal and state laws, and there are monthly premiums for Medigap policies. What is Medicare Part C? This is also known as a Medicare Advantage plan. Medicare Part C plans are health insurance plans that are run by private companies. They are an alternative to original Medicare as provided by the federal government. They are required to provide all original Medicare covered benefits for Part A and Part B. They may provide Part D coverage as well as extra services such as dental and vision. Most plans will have monthly premiums, copays, and coinsurance amounts, but they cannot charge more than original Medicare for certain services and must limit out-of-pocket costs. Want more information? You can view the rest of the videos to learn more. You can contact Granite State Independent Living for assistance. You can visit the New Hampshire Work Incentive Resource Center for resources. You can contact Social Security Administration or New Hampshire's Department of Health and Human Services for more details. If you are connected with an area agency, mental health center, or vocational rehabilitation, you can contact them for more information and assistance. And Service Link centers have trained Medicare specialists.